And we do a multidisciplinary approach at MeBe, which is really, really cool. It really makes us different and unique in that we get to collaborate every single day on kids. We get to look at each other's kids and give tips that we would do based on our discipline and our unique education and knowledge. So the speech side of things, we formally assess the oral motor skills. We address safe eating and food progression, so meaning swallowing, essentially getting the food in the mouth, how you use your tongue, how you use your cheeks, how you chew, and how you swallow. And then we utilize our unique perspectives to collaborate with OT on more of that sensory piece, right? So they're going to really focus on that oral sensations, any of the sensory processing, feeding versus eating, and it really merges beautifully in how we're able to collaborate with both approaches and use our unique training to make the best plan that's unique for your child. So what does an assessment look like? Well, first and foremost, you always want to get an approval or a referral from your pediatrician. Number one, we have so many families who contact us about feeding, and the first thing I always say to them is, have you talked to your pediatrician about your concerns? Have they cleared your child for feeding therapy and for an evaluation? So you just want to make sure you have that medical clearance, that it's safe, because there are going to be some kiddos that are more medically fragile that feeding therapy is going to be better for them in a hospital setting, because we just don't have the, right now, the options to be able to treat a lot of those kiddos because they need that nurse or that doctor very, very close by. So make sure that you get clearance from your pediatrician. Then we're going to do a very thorough interview with caregivers about meal times, your food repertoire, medical history, diagnoses, what's going on, what are those food aversions, what does it look like when you try to present a new food. And then we're going to observe an actual snack or meal time. And we often like to observe a preferred food that your child likes, so we can look at that chewing and those oral motor skills and that swallowing. And then we're also going to look at your presentation of foods that are non-preferred to see how the child reacts, what they do with those non-preferred foods. Also, we're kind of seeing what the environment is, how you typically as a parent present things. Not that we are judging your parental skills at all. It's more so just what can we do to help you make that environment a little bit more pleasant, or what tips can we give you to help you with that presentation. We're always going to do an oral motor assessment. We're going to look at all of those oral motor skills, and that means everything from lip closure, lip strength, tongue elevation, so that's up and down, how your child moves their tongue from side to side, how they move their tongues with food, the strength, the jaw strength and range of motion, how are they moving their mouth, how are they chewing, the cheeks, you name it. We're going to look at the structures, we're going to look at the range of motion, so how they move their articulators or their oral, their I guess you could say articulators, and how they are, what the strength is like. I'm used to saying articulators because that's what I say every day, okay? They are your articulators, okay? But anyways, we're going to do a preference assessment as well, right? We're going to try to figure out, all right, so they are only eating chicken nuggets and they are only eating French fries. That's what we're working with. And this is going to give us so much information about how to develop a therapy plan for your child. So the oral motor assessment, it's basically what I just kind of mapped out, right? We're going to look at the anatomy and the structures. We're going to look at the palate. We're going to look at the tongue ties, lip and tongue, cheek strength or tightness, teeth alignment, missing teeth, the jaw alignment, tonsils, adenoids, the management of the various textures if your child's able to do so, so liquids, purees, which purees are really like baby food, basically, applesauce. That's what we're thinking of when we think of that. Soft textures, hard textures, so soft textures kind of like fruits, really soft fruits, maybe some breads, things like that. Hard textures are going to be your more crunchy foods or your foods. I would even consider like meats as more of a harder to manage-ish texture, especially for a lot of our kiddos. And then the combined textures. So a lot of our kids have issues with the combined textures because they're combined and they don't like anything to mix with each other. We're going to look at the chewing patterns. So are they just chewing up and down like this? Are they chewing they got some jaw sliding? Or they just roll onto one side? Or do they have a rotary chew? Most people don't realize this, but we don't chew up and down. We actually have movements in our jaws from side to side that help grind up the foods. And you have to have a rotary chew to chew up a lot of foods. And then we look at the coordination of all of these movements. It takes a lot of coordination, a lot of strength, and a lot of range of motion. We also will make the appropriate referrals immediately to dentists, orthodontists, ENTs, dietitians, GI specialists after our evaluation. So the road to healthier foods. This is a great example. I love this visual. Granted, we understand that not every child is going to follow this exact road to healthier foods, but this is a great example of how we would work to get them there. So you would start with something that the child loves, which most kids do, and most of our kiddos, they love the goldfish, but they're not into carrots, right? How are we going to get them there? We're going to think about what are some foods that are similar in texture and similar in color, so it's not as scary, right, to get them ultimately to this carrot. So you'll see here we go from the goldfish crackers to the cheese puffs, another favorite that a lot of kids, once they get a few bites, they really like them. Then we go from cheese puffs to the carrot chips. Then we go from the carrot chips potentially to the actual hard carrots, and then we can go to sweet potato fries. So as you see, that's how we're able to expand using what a child already eats. So a lot of families will come to us and say, my child only eats chicken nuggets, goldfish, and french fries. How am I going to expand on it? This is just an example, a visual of how we can help do that. And I love it. It's so great.